Many people in the audience that have been passionate about this issue for many years, many more years than myself. And so we have Barbara Wilson and Kerry Morrison, of course, Brittney Weissman, and other people that really have been passionate about the issue of, and you know, bringing it to the department's attention that we need to be focused on this because we have a crisis going on related to our boarding cares. So I want to start just by making sure everyone knows what I'm talking about. So I'm talking about licensed residential facilities. They're commonly known as boarding care homes. So people often call them boarding care homes, and they're also known as assisted living homes. So that's what I'm talking about. They're licensed by the state, by Community Care Licensing Division, and that these facilities where people live provide 24/7 non-medical care and supervision. They provide 3 meals a day. They help people that may need assistance with their, what we call activities of daily living, maybe cooking or those types of cleaning, those types of things. And also they help with medication management. So when people are taking medication, they can distribute the medication to them and make sure that they're getting what they need. So there are 2 types of boarding care facilities that I'm going to talk about, and that is adult residential facilities, which typically serve people that are 18 to 59. And then also residential care facilities for the elderly, which serve people that are 60 and older, and those are also known as assisted living facilities. So spending a minute on how did we get started on this? Again, I want to talk about the Mental Health Commission, and they released a report in January 2018 called Call to Action: The Precarious State of the Boarding Care System Serving Residents Living with Mental Illness in Los Angeles County. And in this report, they identified concerns about the closures of the boarding cares and called for solutions for the county to address this growing concern. So I can say that our Board of Supervisors is very concerned about this issue, and in September 2018, they had a board motion that was issued by Supervisors Hahn and Supervisor Kuehl, and they directed the Department of Mental Health and Department of Health Services to really focus on this issue. They talked about the importance of this type of housing for people that need the care and supervision that they provide. They identified concerns related to the number of facilities that were closing, and they requested report backs with specific strategies. I can tell you that since that board motion, I think there's been about 3 others. So I've been very busy on this issue. And again, I think it just shows the interest of our Board of Supervisors in this topic. So in case you're not familiar with this issue of why are the boarding cares closing, the main issue here is that they receive a very low reimbursement rate. So a boarding care can take people that have private pay, that just pay out of pocket, and they also can take people that have Social Security income. So, and it can cost as much, people might be aware that some assisted living facilities can cost $5,000 a month or more, thank you. And that, of course, someone who's receiving SSI cannot afford that. So we're focused on the facilities that do take people that have Social Security income or lower income, and that serve people with mental illness. And that for those facilities that take SSI, they receive $1,058 a month. That's how much they get paid for each resident that lives there. And you probably can't do the math in your head, because I know I couldn't, but that is $35 a day. So if you can imagine that we have these facilities that are, providing all these services to people who are very vulnerable, that have high needs, and they're only getting paid $35 a day. And so that is kind of the core of the problem here, and that as the cost of living has increased and other costs to running these facilities continue to increase, the rate that they receive is pretty static. And again, it's set by the state of California. And so many of the ARFs are struggling to stay in business, again, due to increasing labor costs. Also, I'll just say that some of our facilities that have been in existence for many years, they're receiving offers to buy their facilities that they really can't refuse. And so, for instance, we just had a facility that closed that was on Melrose for many, many years, and my understanding is they were offered about $7.5 million from someone who wanted to buy the building and then probably tear it down and build some other, I don't know what they're building, probably apartments or condos or something. So, and that is what's happening, and you know, it's very difficult for these people that are struggling to not want to look at these offers that are being made to them to kind of cash out and get the funds and when they sell off the land. And actually at that facility, the one I just mentioned, the operator was not the owner of the building. And so that's the other thing that's happening is many of the operators are just leasing the facilities, and it's the owner who may not be as mission driven, you know, to serve this population that is selling the buildings. So we are aware that since January 2016, we believe that 45 facilities have closed with a total loss of about 1,226 beds. And we continue to work with community care licensing to understand, you know, how many facilities are closing, how many beds are we losing. And as a matter of fact, that is some of the report backs we have to give to the Board of Supervisors is on that information quarterly. And we know that every time one of these facilities closes, the people that live there, their lives are very disrupted, and they're really at very high risk of becoming homeless. Because again, as more facilities are closing, there's less and less places for people to move to, and it's a very, in that transition period, people are at very high risk. And so I can tell you that there is a lot of coordination that goes on between the department, our public guardian's office, our patient's rights office, and community care licensing, the long-term care ombudsman at the state, everyone, and then the service area folks that are, you know, that their clients are the ones living in the facility, to coordinate to make sure that we're working with everyone there to help them move to another facility and not to become homeless. And unfortunately, this has happened all too often that we've had to do this. So part of what we did over this past year, and again in response to the board motion, is that we had a very robust stakeholder process. And so actually when we came to this meeting earlier in the year, we used the meeting to get feedback from the people that were there, again as part of our stakeholder process. So we wanted to really better understand the nature of the crisis, the needs of the board and care facilities across the county, and DMH along with DHS, we worked with 2 consultants that we hired to work with us on this topic, Lisa Codmore and Elizabeth Sadlon. And it was Elizabeth, they were both at the meeting that I was in earlier this year. And they helped us with this robust stakeholder process. They engaged over 200 stakeholders, including the operators of the board and care, mental health providers, the residents, of course, family members, advocates, and others. And they conducted 50 one-on-one interviews to get people's input. They held small group input sessions. And then we had a larger stakeholder summit that about 100 people came to in May 2019, this year. So out of that whole process, a report was issued, and the report was entitled Sustaining a Vital Permanent Housing Resource, Analysis and Stakeholder Input to Support Adult Residential Facilities and Residential Care Facilities in Los Angeles County. So that report was released. It was released to the board, and if anybody hasn't seen it, we can send it out to this group. You have an group email that we could send it out to if it hasn't been sent yet. So I just want to go over the 6 main imperatives that are in that report that came out of this stakeholder process. The first being the issue that I mentioned earlier, and that is operator financial sustainability, really highlighting the need to increase the operating funding that these facilities are receiving. So that would take legislation and the state increasing the rate, and that would be a potential solution to that, for instance. Also under that category was expanding existing county programs to provide funding to a greater number of clients, expanding other sources of operating funding available for facilities for low-income residents, and identifying financial resources for capital improvements. So those were the items that fell under that category of operator financial sustainability. The next issue is residential quality of life. Of course, that is extremely important. I think that people know that these facilities really vary in their quality, And some you would like to have your loved ones live in, and others you really wouldn't you wouldn't want to live there yourself, or you wouldn't want your loved one to live in. And so really a focus on, we need to help these facilities increase the quality of life for the residents that are living there. And part of that could be accomplished by allowing the facilities to have funding for tenant improvements, so they could fix their leaking roof and fix their air conditionings and buy new furniture and carpeting and things like that. That would really improve the quality of life of the people living there. The third imperative that came out of this process was system capacity, and that is that we really want to preserve the existing bed capacity by exploring ways to prevent further closures. So that is obviously extremely important. The fourth issue is operator effectiveness, and that is creating and sustaining an operator member association for facilities serving low-income individuals, and implementing a real-time bed tracking system. The fifth issue was integrated county services and providing integrated services on site at these facilities. So we're bringing the services to the people that live there, and providing integrated case management, mental health, and substance use services, and leveraging the county systems to provide relevant training and technical assistance to the operators. And then the sixth and final imperative was this state and federal policy advocacy, advocating at the state and federal levels for increased funding and for regulations to support a strong network of the ARC and RCFE facilities. So I want to talk just a couple minutes about some of the strategies that we have been implementing and where we're going. So we at DMH have implemented what we're calling an enriched residential care program. This program is in alignment with and very similar to the program that Department of Health Services have. They've had their program for several years. Again, it's called the Enriched Residential Care Program. And so we have, as a department, invested $12 million to implement this ERC program. And the program provides a couple of things. One is that we are providing what we're calling an enhanced rate for certain participants that are eligible, that are living in these facilities. So currently we're providing an enhanced rate for about 600 clients living in 93 different facilities across the county. And so that's one thing that we're doing. And then secondly, we're also funding for people that have no income or don't have SSI, have a lower income than SSI, for instance, that we can actually pay for their board and care rate, or the SSI rate, for them to live in the facility. This is a program actually that the department created, I think back to the 90s, and it was called the Interim Funding Program, and it was managed by our countywide resource management division in the department, and it was transitioned over to my division, and is now part of the ERC program. And so with that program, we are serving 155 individuals. So for those individuals, we're paying for them to live in the board and care, again, because they do not have an income, and we're also paying the enhanced rate for those people living in those facilities. And then DMH, this year, we also leveraged whole person care funding, and through that program, we're providing the enhanced rate for about 200 individuals, and that program is still overseen by countywide resource management. So in the Department of Health Services, Housing for Health, and their program, their ERC program, they're serving about 1,200 people countywide. So between their 1,200 and our 600, you can see we're serving about 1,800 people right now across the county with some kind of increased rate, which provides more funding to the facilities where they're living, which allows them to take people that have more complex issues, people that they might want to reject because they think they might be too difficult to serve. So having more funding for them to provide an increased level of services is the intention behind the enhanced rates that we're paying. We're also working very closely with community care licensing, really strengthening our relationship with them, our communication with them, making sure, for instance, that if there's concerns going on in a facility, certainly if either of us know that a facility might be at risk of closing, that we are talking to each other and that we are coordinating with each other. and making sure that we're, again, if a facility is actually closing, that we're working together to make sure, along with the operator, that nobody is not being transitioned to another home. And that is a big part of the work that we're doing. We have monthly meetings with community care licensing, so I can tell you, for instance, our monthly meeting was this morning, and that we had a very long conversation about work we're doing together on a facility in Pico Rivera that the community is very concerned about and has been complaining about. And there was a meeting with the City Council in Pico Rivera to hear their concerns, and we are all working together to address the issues. And part of the concern there is the number of calls that the Sheriff's Department receives to go out there. And what we learned today is that a lot of those calls are related to when people leave the facility without signing in and out. There is a policy that they're notifying and doing a missing persons report. So we are working with the public guardian and community care licensing, and we plan to meet with the Sheriff's Department to address this issue and talk about how we can collaborate together to see if there is a way to reduce the types of calls that the number of calls that they're receiving. So that's just an example of the type of collaboration we're doing.
I'm just noting that we have 10 minutes left, and I wonder if we can ask you to wrap up within 5, and then we can ask 1 or 2 questions in the remaining 5.
Okay, absolutely. And then the other thing we're doing is we're trying to bring substance use services on site at some of the facilities. We're working with Department of Public Health, SAPC, developing a pilot at a facility that we've identified in Pasadena to offer substance use services there. So that's another way we're trying to expand the services. Many of these things will take a legislative fix, and so I want to let you know that that this year, just recently, the California Behavioral Health Directors Association spearheaded a budget ask that was sent to the governor, asking for $500 million of one-time money that could be used for these enhanced
rights. Can we ask the background noise to kind of minimize? It's getting difficult to hear the presentation.
So that is with the governor, and that's just a one-time fix. And the other part of what the budget ask is that we want to have a work group to have a long-term fix. And again, we think the long-term fix is increasing the actual SSI rate. So that we'll look to see in January if that is in the budget that the governor releases. And if not, there'll be continued advocacy to get something in the budget. Also, I just want to acknowledge our other partners in LA that are working on this issue. That it used to be no one was talking about this issue in homeless services and housing, or not many people were, I'll say. Los Angeles Homeless Services Authority sent a letter to the governor acknowledging the board and care crisis and urging him to work with the county of LA and all the counties to create a financial environment that really supports this long-term housing option. And then also the city of LA drafted a resolution this year saying that in their state legislative agenda that they want to support any work, again, in this area. So I think that's really great that other partners are coming forward. So finally, and actually really great news, I just want to let you know that yesterday we responded to the Board of Supervisors from their most current motion and let them know that the department has identified $11.7 million, and it's in response to...
May we have quiet in the background, please? It's very difficult to hear this important meeting. Thank you.
So the department has identified $11.7 million in response to the stakeholder report. And so about $11.2 million will be dedicated for capital improvements to the facilities. And we'll have an opportunity for the facilities to apply for that funding so that they can make improvements to their facilities. $500,000 will be used to seed a membership association. So we will be moving forward with that. And then also we're working on a bed tracking system, and it may be actually that we don't need funding for that because it turns out that our department is developing a bed tracking system that we can potentially use. And that would be an opportunity for operators to be able to input when they have open beds, and for people that are working with someone or someone themselves, if they're looking for a place to live, that they can look there and know where there's openings. And we want it to be a live bed tracking system. And then the last thing I'll say is that we also plan to have a stakeholder meeting on February 18th, 2020. This is hot off the press, brought to you here. So if you're interested in coming, put a hold on your calendar. It's going to be at the California Endowment. Yes.
February 18th, what time?
Thank you. February 18th from 10 to 12 at the California Endowment. More to come on the agenda. We'll be passing out a flyer to let people know about that, so you'll have more details about it.
Thank you so much,
Bravo.
Maria. We are going to ask for questions from commissioners.